Dr. B, my mom went to the dentist the other day because she's complaining of her teeth hurting and feeling like they're loose. And when she went, they told her that she had periodontal disease. What in the world is that?
Oh, wow. Yeah, well, I feel sorry for your mom. Most cases of periodontal disease, first of all, is gum disease. That's what most people call it. And a lot of people don't understand or realize that gum disease is the #1 cause for the loss of teeth in adults. The bad thing about gum disease is it doesn't hurt. If gum disease hurt, we would be seeing people all the time complaining. About 75% of the adults in the United States have some form of gum disease in their mouth. And it's been my experience that about 90% of those people don't even know about gum disease or the fact that it's in their mouth. So if you'd like, you could have your mom come over. We could do a consultation with her. We have several non-surgical approaches to treating gum disease. And I can tell her the whole story of gum disease.
Is that something that I should be concerned about since she has it?
Yeah, that's one of the myths in dentistry is that my mom lost all of her teeth at 20 because of gum disease, so I'm doomed to lose my teeth. When in fact, gum disease is caused by the bacteria that live in our mouths naturally.
Okay.
There is a mild genetic component to it, but almost all gum disease is caused because of either poor oral hygiene or not going to the dentist and getting your teeth cleaned regularly.
Okay.
Would you like to know more? I've got a visual I can show you.
Sure.
All right. Let me grab this. So Amelia, these are photographs that explain gum disease. Let's start at the top. First row is normal, healthy gums and bone. The gums are nice and pink. They're a coral pink. You don't see any puffiness or bleeding. And if you look at the x-ray over here, this gray stuff around here, this is the bone that actually holds your teeth in place. And you can see the bones right up around the necks of the teeth. That's all normal. So this is normal and healthy. When this patient brushes and flosses, they see no blood in their mouth or on their floss or toothbrush. Okay? The first step of gum disease then is caused by bacteria building up on our teeth. All right? And that's called plaque. And those bugs make a sticky, gooey substance that allows them to stick to our teeth and to our gums. And you can kind of maybe see it a little bit here. It looks kind of fuzzy. I call them fur coats on patients.
Mossy.
There you go. There you go. So that's the first stage of gum disease. You can see the gums are a bit swollen. They look a little red. And the gums will readily bleed when you brush or floss. Okay? So if your gums bleed when you brush or floss, you have gum disease. More than likely, it's gingivitis. That's what we call gum disease when it's just in the gums.
Okay.
All right. If we look at an x-ray of a person with gingivitis, you can see the bone is still normal. So the bone has not been infected. Periodontal disease goes in stages. It starts with gingivitis, that's just in the gums, and then left untreated will move to the bone that holds the teeth in. Okay, and that's what's going on with your mom. If her teeth are getting loose, that means that she's losing bone around her teeth. It's just a matter of how much bone has she lost.
Right.
Okay, so and that's what these lower photographs are showing. This is when the gum disease is starting to move from the gum tissue itself into the bone that holds the teeth in. And you can see here, you start to see little pits in the bone. Okay, you can see the gum starting to recede a little bit. It's kind of puffy looking. All right, so that's type 2 gum disease. Left untreated, it moves on. And then, like I said before, the sad thing is it never hurts until it's too late. So left untreated for a few years, you can see now on this x-ray, the bone has really started to disappear around the teeth. About half of the bone is gone. And generally when you start to get a half or more of the bone, that's when the teeth start to get loose. All right? And if you look right here on this picture, you'll see a white chalky substance. That's what most people call tartar or calculus. All right? What tartar and calculus are actually colonies of bacteria. Those bugs have been living on that tooth so long that they picked up calcium from the saliva, and now they're calcified onto the tooth. They're kind of like barnacles.
Okay.
So once this stuff forms on your teeth, you could brush your teeth 100 times a day, floss them 50 times a day, it's not coming off. So those bacteria are living there 24 hours a day, 7 days a week. And every time you eat, they take the food that you eat and they turn that food into acids and toxins. And it's those acids and toxins that cause the bone to slowly disappear. All right? In fact, if you look at this x-ray right here, you'll see these little bumps on the root, okay? Those are actually colonies of bacteria. They picked up calcium. They're calcified onto the root now, and they're what's causing all this bone to be lost around this tooth. And that's the end result of gum disease, is the bone is all gone, and now the tooth has to be removed. And people talk about the domino effect of gum disease, and that's what's going on here. This root of this tooth has lost so much bone, now it's caused bone loss on the tooth in front of it. So this tooth needs to be removed. So gum disease is very treatable. It can be controlled but not cured, because it's the bacteria that live in our mouths naturally that cause gum disease. So the whole idea is to keep the bacteria off of your teeth, and you do that with routine teeth cleaning. So in order to treat gum disease, what we do is we want to get rid of the cause. And that's these bugs that are living on the roots of the teeth. We want to get all of them off nice and clean, and then your body will have a chance to heal itself.
Okay.
We would really like to see your mom, and the next time she come in, we'll do a complimentary consultation.
All right.
We'll take some films, and we'll be able to see exactly what stage of gum disease your mom's in, and then we can come up with a treatment plan for her.
Okay, thank you, Dr. B.
You're very welcome. Thanks for asking.